Greetings, colleagues. Welcome to this FIP webinar entitled Enabling Pharmaceutical Education Transformation in Southeast Asia, launch of FIP-UNESCO UNITWIN Centre for Excellence. My name is Dalia Burgess, and today I am one of the moderators for this session, supported by my colleague Alison Itukagban. My role at FIP is lead for provision and partnerships, and I am delighted to be your co-moderator for today's important event. We'll start off with some housekeeping matters for you, just to support you as you attend that webinar, whether you're here now or listening in afterwards. This webinar is being recorded and live streamed via Facebook. The recording will be available on our website at www.fip.org. You may ask questions using the question box provided. We encourage you to do so, particularly during the panel discussion, as our speakers would be delighted to navigate those. You're also welcome to provide us with feedback about our events by emailing us at webinars@fip.org. Remember as well, if you are not a member of FIP yet, we encourage you to explore the member benefits on our website and visit this on fip.org/membership_registration. So welcome everybody. Today's event is an important event at FIP. And today actually marks a significant and a new milestone for us at FIP and the wider profession. In this event, we will celebrate the initiation of a new FIP-UNESCO UNITWIN Centre for Excellence in Southeast Asia. And I promise you, you will learn all about this network in today's webinar. But just to help those listening immediately, let me share that in 2010, FIP and the United Nations Educational, Scientific and Cultural Organization, UNESCO, launched a unique global program titled the University, Twinning and Networking, abbreviated UNITWIN. It is referred to as the Global Pharmacy Education Development Network. This FIP-UNESCO UNITWIN program was the first in the field of higher education for health professionals and the first for global pharmaceutical education. And it is in the same year that FIP-UNESCO UNITWIN Centre for Excellence in Africa was set up with deans and heads of schools of pharmacy. So we are delighted that today will mark a launch of a new Centre for Excellence that is located in the Southeast Asia region. Our event is enriched by our esteemed speakers. From FIP, we have Dr. Catherine Duggan, the FIP CEO. We also have Shirley Milianti, who is the FIP Data and Intelligence Specialist from FIP and the Regional Account Holder for Southeast Asia. We have with us Dr. Rajani Shakya, who is an Associate Professor, Department of Pharmacy, School of Science at Kathmandu University in Nepal. We are also delighted to have Dr. Andy Hermansyah, who is an academic from the Faculty of Pharmacy, Universitas Erlangga in Indonesia. We are honored to have Professor Ralph Altieri, who is Dean and Professor from the United States as Sachs School of Pharmacy and Pharmaceutical Scientist. He's also our FIP Education Chair. We have with us Dr. Editha Danestein, who is the Head of Internal Quality Assurance System, Faculty of Military Pharmacy at the Republic of Indonesia Defense University. We have apologies from our dear colleague, Dr. Rao Vadalmudi, who is the immediate past president, professional secretary of the Southeast Asia Forum region. But we have comments from him that we will share with you during the panel discussion. I am supported by my co-moderator, as I said earlier, Alison, who at FIP is the FIP Educational Partnerships and Projects Manager. Welcome our esteemed speakers and presenters for the panel. So today's objectives, we hope that by the end of this event, you will learn more about the Southeast Asia region's pharmaceutical education landscape and the needs and priorities of the region. You'd also develop an appreciation how collaboration among institutions, researchers, academics, experts can drive innovation and improvement in pharmaceutical education. You will also be able to develop knowledge about the significance of networking in creating a supportive ecosystem for educational development in the region. Together, we will be able to explore how the specific center in Southeast Asia will contribute to the transformation of pharmaceutical education in your region and the alignment of this center with FIP's development goal. So today's program, after the introduction that I've just ran through with you, we will be provided by an overview of the UNITWIN Network on Global Pharmacy Education by Alison. We will also then we'll learn about the pharmaceutical education needs from the Southeast Asia region, supported by Dr. Shirley Milianti and Alison. We will then move on to the launch of the Center for Excellence in Southeast Asia, which will be presented to us by Dr. Rajani Shakia. And then we will proceed to around 40 minutes of a panel discussion. We will invite all of our panelists to discuss the role of collaboration and the importance of collaboration and networking and educational development in a regional sense for pharmaceutical education transformation. And then we will be closing the webinar with further information on resources. So without any further ado, I'd like to present our first speaker. Ms. Alison, the floor is yours to talk our audience through an overview on UNITWIN as a network on global pharmacy education development. Thank you so much, Alison.
Thank you, Dalia, for the introduction. Hello, colleagues. My name is Alison Etgopan. I'm delighted to join this event today, to be part of it, to present to you an overview of the UNITWIN Network on Global Pharmacy Education Development. The next slide, please. So the UNITWIN Network on Global Pharmacy Education Development is a very powerful initiative and an enabler that holds potential to transform the world of pharmaceutical science and practice through education. The primary purpose of this network is to promote an integrated system of research, teaching, and training, as well as encourage community engagement and communication. By fostering collaboration between high-level international recognized researchers and teaching staff, this network brings together different schools of pharmacies and stakeholders to really progress the field of pharmaceutical education. And we might wonder, how does the network achieve this? So the UNITWIN network achieves its objective through 4 key pillars, as we see from this bubble. We have networking, we have educational development, actually developing resources that enables education standards and things like that. Then we have the best practice sharing of experiences, sharing of resources, and of course we have partnerships working together to achieve all of this. These 4 pillars, when put together in synergy, brings all the initiatives and activities of the network together, facilitating the implementation of FIP development goals. So through this network, we're not just addressing pharmaceutical education, but actually we're addressing global health concerns and advancing pharmacy worldwide. In an era where health is a global concern and innovation is key, the UNITWIN network plays a crucial role in shaping the future of pharmacy practice and science through education. By connecting brilliant minds and stakeholders and academic institutions from diverse backgrounds, we are not only improving the quality of education, but we are also strengthening our ability to address the pressing health challenges facing the world, enabling the pharmaceutical workforce. Next slide, please. So I would like to just give you an overview of the milestones since the network was established. Dalia has kindly mentioned that this network was established in 2010, of which we also established a regional center in Africa focused on addressing the needs-based education in that region. And of course, moving forward, since it's a working relations with UNESCO, the agreement was renewed in 2014, and keeping our dedication and commitment to building this network. Then in 2018, we had a milestone because the network, they showed great adaptability by conducting needs assessment, renewing of strategies to just restructure the FIP-UNESCO UNITWIN Centre for Excellence in Africa. And in 2019, progress was still made with this center. But in addition to this, the Center for Excellence in Africa made a decision that they would like to transition to the African-wide Association of Schools of Pharmacy in order to encompass other academic institutions from the region and enhance collaboration and working together. In the next slide. And in 2020, UNITWIN made a significant stride by launching the FIP Pharmacy Education in Sub-Saharan African report, which is the first of its kind impact report that showed data and of the status of education in that region, the country profiles, the educational needs, the activities, and everything. And then in 2021, a couple of other resources were published, but this year really showed that UNITWIN can thrive on collaboration, sharing, and working together. And this was achieved through the 6 regional workshops that were held and a groundbreaking global summit. So this year, in 2021, several resources were launched, including the FIP UNITWIN Pathfinder Toolkit, the regional roadmaps that shows how education would need to be transformed in each regions of the world to meet the needs of the region. We know that every region is unique and one size doesn't fit it all. So one approach doesn't fit it all. That's why these roadmaps are really key and crucial for every region's educational need. And in addition, in that year, 2021, we also launched the Global Call to Action for Advancing Pharmaceutical Education as a comprehensive resource to show the next steps and the things that needs to be done to ensure educational transformation globally. Then in 2022, of course, we continued to build on all of these achievements, and we launched the FIP Toolkit for Addressing Inequities in Pharmaceutical Education. This is a resource that helps academic institutions and stakeholders to ensure that their education and their educational practices are equitable and inclusive. And also we launched the FIP Education Transformation Toolkit, which is a toolkit that gives access to all relevant education-related resources from FIP and other stakeholders. Now, in 2023 and beyond, we are committed to reaching new heights, and we are thrilled to announce that our agreement with UNESCO was renewed for the period of 2023 to 2027. And our priorities during this period will include taking this initiative from one region across the different regions of the world, like starting with the Southeast Asia region that we are doing now. And of course, implementing the roadmaps and establishing the African-wide Association of Pharmaceutical Schools, in addition to other objectives of this agreement. UNITWIN's journey has been one of innovation, collaboration and dedication. And our commitment to advancing global pharmacy education is unwavering. And this milestone represents our collective efforts to ensure brighter future for pharmaceutical education worldwide. In the next slide, please. So here, I would just like to shine the light on some success stories that have come out of the Pioneer Center for Excellence in Africa. We have that this center had academic institutions from Namibia, Ghana, Malawi, Uganda, Kenya, and Nigeria. And from Namibia, being a part of this Center for Excellence helped the University of Namibia to actually start the first school of pharmacy in that country. And the school enjoyed support from already established institutions, and they also had the academic capacity strengthened through getting external examiners and members of the centers coming in to support the program. And in Ghana, for instance, we had that this center, a member from this center benefited greatly through seeing the pharm program progressing and involvement in other stakeholders' initiative in the region. In the next slide, we will see the success story from Malawi, where we had provision of resources to the laboratories in the university and also addressing academic capacity issues through exchange of staffs and support. But also there was a success story here that the center helped with, curriculum review expertise, enabling the pharmacy degree to align with global trends. So really adapting global context in the country's context and ensuring that needs-based education is followed. And in Uganda, we had a story of advocacy where through membership of this center, the university enjoyed more advocacy. They had the opportunity to expand their departments to attract more resources. So this is just an highlight of what the values and what the members of the center from the Pioneer Center have enjoyed. And I know that during the course of this event, you will learn lots more about the value of these collaborations and learning. In the next slide. So now moving forward in 2023 to 2027, we have signed the MOU with UNESCO, and we are now using this network to deliver education transformation globally. And not just education transformation, but this aligns with our different priority programs here at FIP, including the surveillance program, where the provision programs, as well as we align and assess our needs with all regional centers. To just round up my presentation, in the next slide, I would like to shine the light on what the specific objective of this new agreement is. So in addition to promoting research and training, as well as overarching contributing to global health and working closely with UNESCO and other UNESCO chairs, we are very keen to lead educational and scientific transformation and promote global collaboration to address issues regarding sustainability in pharmacy, inequities, technology in education. And that's why we are going to be establishing new regional centers for excellence across all regions of the world, of course, starting with the Southeast Asia region today. So that's a wrap up of this overview. I'll be happy to take your questions during the course of the event. I'll hand over now to Shirley to present. Thank you.
Thank you very much, Alison. Good day, everyone. Today, I'm excited to share some insights on the pharmaceutical education needs in Southeast Asia. And my name is Shirley Melianti, and I'm in FIP as a data and intelligence specialist. And I will be doing a double act with Alison in this presentation. Let's start first by discussing the needs-based approach for transformation. So at FIP, we advocate for aligning pharmaceutical education with the health needs of local populations and national priorities. And this approach calls for locally or regionally determined, socially accountable, globally connected, and quality assured education. It is about understanding the community needs and shaping education to meet them. And how do we gather these needs? So the answer, of course, lies in data. According to the WHO Working for Health 2022-2023 report, data plays a role in making informed decisions. And just as in healthcare and education, a data-driven approach is essential for education transformation. So in another word, basically, it is important to have a needs-based data-driven approach in doing education transformation. And that's what we would like to share with you today related to the education needs for the transformation. Before we move to the data itself, perhaps let's take a closer look at the Southeast Asia region. So according to the WHO, this region comprises 11 countries or member states, but it is a home to nearly 2 billion people, over a quarter of the world populations. And within FIP, we have a strong presence in this region. We have 7 member organizations across 6 regions. We also have like 20 academic institutions and over 200 individual members. And looking at the health needs in the region itself, this box here highlights the 8 WHO regional flagship programs of this region, focusing on the maternal and child health, measles and rubella, universal health coverage, neglected tropical diseases, non-communicable disease, antimicrobial resistance, health emergency, and ending tuberculosis. As our needs-based approach previously, it is important to align our educational transformation towards the healthcare needs in the region, which the one that we highlight here. And now let's dive into the data that illustrate the education needs in the region. And here we will present a little bit information from the insight that we found from our recent global workforce surveillance project, and also our needs-based global analysis for policy development, which is an output from the UNITWIN workshop that we organized in 2022, which will present by my colleague Alison later on. These findings not only highlight the current status, but also guide us in shaping the future of pharmaceutical education in Southeast Asia region. And from Southeast Asia region, related to the FIP Global Workforce Surveillance Project, there are 6 countries contributed to this project. And this is a little bit information about the data that we found. So you can see in this line chart a number of pharmacies, density, number of pharmacies per 10,000 population, which we also call it as density. The trends from 2006 to 2022. So we gather the data across like 5 data points: 2006, 2009, 2012, 2016, and 2022. And you can see here there's a general increased trends across countries. The top one is India, the second one is Thailand, the third one is Sri Lanka here, and then Indonesia, Nepal, and Bangladesh. We can see the data that we gather here, we also calculate the mean for the global population in 2022, and the mean for the global population in 2022 is 9.9 pharmacies per 10,000 population. And we can see from this line chart, actually the density, like the top density of India here, it is still like 8, which is less than the mean for the global population in 2022. moving forward, we can also see the trends to 2030, and compared to other regions, similar with the previous data that I share, we can see that Southeast Asia region actually has the second lowest gradient compared to the other regions. And the projection to 2030, assuming if there is no change in linearity, this will indicate that the global variance for pharmacist density will continue to widen, and this will have, of course, implications associated with the rise of inequity of accessing medicine expertise, accessing of the pharmaceutical service provision by pharmacists, and also the gap, if we didn't do anything, it will continue to widen until 2030. And we can also look at the graduates by region as well. And here you can see, similar with the before, which is Southeast Asia is actually also the second lowest number, have the second lowest number of graduates per 10,000 population compared to the other region. And what the data tell us so far. So there is an increase basically for the trends for the pharmacist number in the region, but it is still low progress. And there is also a need to increase the number of graduates in the region. And one thing that we can do is actually we can facilitate the recruitment. And actually within FIP, we have this handbook. It's called as a strategies to improve enrollment in School of Pharmacy. And it has a compilation of 30 examples of activities that can be done by members, by the institution on how to improve the student enrollment. So this could be a very useful resources. And another thing that we highlight from this project is also a need to strengthen the data and intelligence regarding this workforce capacity, because there are a couple of countries that we didn't receive the data, and also even we received the data is not complete. So the country itself face some challenges in gathering the data. So there is a need to strengthen the data and intelligence related to this topic. And I will now give the floor to Alison to share with us about the needs-based global analysis for policy development, which is the outcome that we did with our UNITWIN workshop last year. Alison, over to you.
Thank you, Shirley. So quickly, I will just show you here the methodology that was followed to develop a policy for pharmaceutical education transformation. And this, as we mentioned, was done during the UNITWIN workshops in 2021. Regional stakeholders across the different WHO regions came together to, share their needs, their priorities, their expertise, room for improvement, and those elements aligned with the FIP development goals. So in the next slide, I would like to shine the light on what really came out for the Southeast Asian region, which is the SWOT analysis on pharmaceutical education for this region. First of all, let's begin with acknowledging the strength that this region has in pharmaceutical education. There is the abundance of student resources with a wealth of pharmacy students, creating a strong foundation for education in pharmaceutical field. And there is also the elements of research and curriculum excellence, where the data showed that the region excels in pharmaceutical science areas such as drug delivery system, pharmaceutical biotech, pharmacogenomics, precision medicines, and herbal medicines. And now let's exploring areas for improvement. We have that there is a need to enhance pharmacy practice education, particularly in patient-centered care, clinical pharmacy, and interprofessional education. And also there is a bit of curriculum diversity. The lack of this alignment and harmonization of pharmacy curriculum in the region can pose a challenge on the educational standard in that region. And with regards to capacity development, there's room for improvement with regards to career, leadership, and academic capacity development, especially for preceptors and young faculty members. Moving forward, let's discuss the exciting opportunities that await this region in pharmaceutical education. Of course, therein lies the opportunity for collaboration, which is, in this essence, building the FIP-UNESCO UNITWIN Centre for Excellence for the region, which we are doing today. There's opportunity for global research collaboration, partnership with advanced universities and institutions on drug discovery, leveraging sophisticated equipment. There is opportunity for developing specialist programs, that aligns and matches with the needs of the region. And there are opportunities with regards to continuing professional development, ensuring that we implement priority strategies that will enhance the skills and the knowledge of practicing pharmaceutical workforce. And of course, we have certain threats, of course, certain things that could derail this. There are possible challenges due to a variation across the countries in terms of capacity and in terms of policies. This might hinder the quality and the harmonization of education and workforce development in the region. And of course, there is the issue with integration, where the convergence and integration of the pharmacy profession into the healthcare team could affect interprofessional collaboration. And of course, there's financial stability issues, which could affect the infrastructures and resources needed for education. But be rest assured that most of these challenges are common across different regions of the world, and these initiatives and the likes are putting together to ensure that we advance and transform pharmaceutical education, leaving no region behind. Thank you very much. I will hand over back to Shirley to wrap up. Thank you.
Thank you so much, Alison. So building on what Alison said about the SWOT analysis of this region, here are a couple of summary that we gather basically related to what the education needs from this region. So the region benefits from a strong supply of pharmacy students. This is actually providing a solid educational foundation, but we still need more according to our recent data on number of pharmacies in this region. The second point will be like, while this region excels in delivering research and curriculum in pharmaceutical science area, there is still gaps found in pharmacy practice education, particularly related to patient-centered care and interprofessional education. And there is also a need for investment in career, leadership, and academic capacity development, particularly for preceptor and younger faculty member. And we at FIP actually have some resources to support this region, such as our global competency framework, our global advanced development framework, and our global competency framework for educator and trainers. And last but not least is about the needs for strengthened data and intelligence to provide foundations for informed decision-making in the educational needs. That's to close my presentation, and I will now give the floor to our next speaker, who will talk about the UNESCO UNITWIN Centre for Excellence in Southeast Asia, Dr. Rajani Sakya. The floor is yours.
Thank you so much, Alison, for the introduction. I'm extremely glad to be here in this forum today. It's an honor to be part of this venture as a project lead. I'm Rajani Sakya from Kathmandu University, Nepal. I would also like to introduce Ms. Mansi Joshi. She is the deputy lead for this project. Together, we will be working in this venture of FIP-UNESCO UNITWIN Centre for Excellence. Next slide, please. Southeast Asia region is one of the most culturally diverse regions of the world. There are many different languages and ethnicities over here. As we all know, Southeast Asia region has several challenges in healthcare. to meet these requirements, there is a requirement of highly competent workforce, and this requirement highlights the need of stronger academic capacity and high quality education system. FIP with UNESCO UNITWIN Centre of Excellence will be supporting the development of pharmacy practice and sciences in this region by enhancing academic capacity through intra-regional academic partnership and exchanges. This center aims to build a network of academic capacity building, best practice sharing, and educational exchanges among members of Southeast Asia region, with support from global stakeholders to advance the transformation of pharmacy practice and science through educational context. In this slide, you can see the objectives of FIP UNESCO UNITWIN Centre for Excellence in this region. The Center of Excellence in this region will enhance the integrated system of research, training, information, and documentation activities in pharmacy education within this region. This center will lead educational and scientific transformation and promote inter-regional collaboration to address sustainability, inequities, and technology in education in this region. It will cooperate closely with existing FIP UNESCO UNITWIN Centre for Excellence, as well as UNESCO UNITWIN Network on relevant programs and activities. The Center of Excellence will provide a platform for networking and partnership with academic institutions of this region. Member organizations will be sharing and learning from each other's experiences, their practice models in education and patient care. This collaborative effort will contribute towards educational development in the member institution, nations, and in the entire region. Next slide, please. The next objective of this Center for Excellence is to implement the FIP UNITWIN regional roadmap for transforming pharmaceutical education. For this reason, the center will specifically work on 3 development goals that have been prioritized for this reason. The center aims to adapt FIP's global competency framework into the regional context. This objective is in line with FIP Development Goal 5, that is Competency Development Goal. Competency framework is a model that explains competencies essential for performing pharmacist work effectively within the area of practice. The FIP Global Competency Framework can be used as a mapping tool to develop country-specific frameworks according to the local needs of pharmacy practice. In some of the Asian countries, till today, there might not be any competency frameworks developed for pharmacists. The lack of these fundamental standards and framework presented a barrier for pharmacists to identify their learning and training needs. Wherever the pharmacist is working in, there is a need for an evidence-based development tool which will serve as a guide for their performance, support their career development. This competency standard will ensure the quality of initial pharmacy education and training requirement, and it will provide a basis to further develop the profession in the various roles. The next task in regional roadmap is providing young faculty members with opportunities to build academic capacity. This is in line with the development goal 1, that is academic capacity development. Capacity building of faculty members, especially the younger faculties, is very important for academic capacity enhancement of any institution. Only the proficient and motivated faculty members will be able to prepare the pharmacy cadres competent enough to meet the demand for their quality patient care service. To achieve this objective, the Center for Excellence will be developing Train the Trainer series for all levels of academics, linking to the FIP competency framework for educators. And the third task in the roadmap for this region is to build continuing professional development or CPD culture by leveraging FIP's existing CPD strategies and resources to develop a CPD toolkit. CPD is a culture of lifelong learning, which ensures pharmacy for the lifelong acquisition of knowledge and skills. This culture should be ingrained from the undergraduate level itself. And this objective will be supported by the provision program and the FIP seal for quality. Next slide, please. Now, let me introduce to you the founding members of this center. I'm glad to say that till date, we have 7 universities from 5 of the 11 countries in the WHO Southeast Asia region. We have academic institutions from Bangladesh, India, Indonesia, Nepal, Thailand as the founder member institutions. This Center for Excellence brings together pharmacy education experts and resources in the region to advance the transformation of pharmaceutical education, inspired by the FIP UNITWIN regional roadmaps on pharmacy education and aligned with the FIP development goals. The center has both academic institutions and individual members who are in academia as members across India, Nepal, Thailand, Bangladesh, and Indonesia. In the dark blue box in this slide, you can see the academic institutions, and the names in the light blue boxes in this slide are the individual members of this Center for Excellence. If you check the founding member institutions, we have Kathmandu University, Nepal, Mahidol University, Thailand, Sri Ramachandra Institute of Higher Education and Research, India, the Republic of Indonesia Defense University, Indonesia, Universitas Airlangga, Indonesia, BRAC University, Bangladesh, and Universitas Indonesia. In addition, this center will also be supported by stakeholders across FIP, including the Southeast Asian Regional Forum, the FIP Hub, FIP Women in Science and Education, as well as early career pharmacist and student. Next slide, please. Now, kindly allow me to go through, in very brief, the key areas of proficiencies of each of the founding member academic institutions. Let me start with Kathmandu University, Nepal. Kathmandu University is an autonomous, not-for-profit public university located in Dhulikhel, Kavre, Nepal. It is an institution of higher learning dedicated to maintaining the standard of academic excellence in various disciplines. This university is doing excellent in education and research related to drug delivery system, medicinal plants and natural products. There is a good scope of collaborative research activities in community health with Kathmandu University. This university has a good number of experienced faculty members who can contribute very well for framing policies related to pharmacy and pharmaceutical sciences, education and practice in the region. Next slide, please. Our second member institution is Mahidol University in Thailand. Mahidol University is one of the most prestigious university in Thailand. It is internationally known and recognized for the high caliber of research and training. This university can serve as an education hub for junior faculty members from developing countries through all English master and PhD program. Mahidol University can serve as a role model on quality assurance process throughout the student life cycle. This university provides technical support for other developing countries in the region. Next slide, please. Our third member organization is Sri Ramachandra Institute of Higher Education in India. Sri Ramachandra Institute of Higher Education is ranked among the top health sciences universities in India. It is a private, not-for-profit, self-financing institution and is dedicated to serve the society as a center of excellence with emphasis on medical education, research, and health. This institution has achieved academic excellence through pioneering in pharmacy education in diverse areas and promoting gender equity and affordability. Sri Ramachandra Institute of Higher Education focuses on career enhancing competencies, and skill development. It has achieved proficiency in antibiotic stewardship as well. Next, please. Now we have the Republic of Indonesia Defense University, Indonesia. It is a world-class defense university based on research that preserves national values. Area of proficiencies of Republic of Indonesia Defense University includes military pharmacy education and research in military pharmacy field. This institution has excellent international collaborations. Next one, please. The fifth university is Universitas Airlangga, Indonesia. This is the second oldest university in Indonesia and is also a public university located in Surabaya, East Java. This university is consistently ranked high in major world university rankings and is one of the most esteemed universities in Indonesia. Universitas Airlangga has experienced experts and has established several networks across Asian countries. This university has demonstrated top quality performance as evidenced by several accreditation bodies. Next, please. This is a sixth member organization, Universitas Indonesia, Indonesia. It is a public university, one of the oldest tertiary level educational institutions situated in Indonesia, and is one of the most prestigious universities in the country. Area of proficiencies of this institution includes herbal medicines, medicinal chemistry, pharmacology, and clinical pharmacy. Next one, please. Last but not the least, we have here BRAC University, Bangladesh. It is a private university located in Dhaka, Bangladesh. BRAC University is the institution with high academic standards. Areas of proficiencies of BRAC universities are listed over here. BRAC University has student-centric learning environment. This institution prioritizes academic capacity building and collaboration in innovation and research techniques for optimizing medication treatments, educating patients, and implementing interventions to improve adherence. Next, please. Those were our founding member institutions, member organizations for this center. Since 2010, the FIP-UNESCO UNITWIN Centre for Excellence had been an incubator of transformation in pharmacy education. FIP-UNESCO UNITWIN Centre for Excellence in Southeast Asia region intends to advance academic capacity of institutions and establish need-based education strategy, improve competency in educators, and instill the culture of CPD by building university networks and encouraging inter-university cooperation throughout the region and also worldwide. For achieving the goal of transforming pharmacy education, there is a need of more vibrant regional network of educators. This network will be the voice of pharmacy and a tool for advocacy for the profession at the national and regional levels. We have till date 7 universities from 5 different countries in WHO Southeast Asia region. I hereby would like to request other institutions and educators from this region to be a part of this endeavor. Together, we can improve pharmacy education and practice in our region. Thank you so much.
Thank you so much, dear Rajani, for the great launch news for the Southeast Asia Centre for Excellence. Congratulations thus far. I would like to now invite all of our speakers, our panelists, to put their cameras on to join us in a panel discussion to really explore and reflect this great initiative and to also reflect on what we've heard from all of our speakers. Thank you so much. Welcome, everyone. Great to have you here. Welcome, welcome. I can see all of you now. And Shirley is there as well. Editha and Andy, great to have you. We're going to have some questions for you, and we'll try and go in turn to hear from all of you with your remarks. I'd like to start us off by remarks from our CEO, Dr. Catherine Duggan. Catherine, I'm sure that you're delighted by everything that we've heard and listened to from our previous speakers, and congratulations to FIP and this network on the progress made thus far. It's really, really encouraging, exciting news for us. And as CEO of FIP, I'm wondering if you could share with our audience some of the specific initiatives that FIP has undertaken to support educational and professional development in various regions, and those with unique needs and systems that can be different from their counterparts. How does FIP also tailor its approach to accommodate the diverse regional requirements? Would love to hear from you on that.
So I think, Dalia, it's a huge congratulation day, a huge day of celebration today for this network and for the focus now on Southeast Asia. And I would, if I may just say, even within regions, there is so much difference between nations and even within nations. So it's just a very difficult thing to apply, almost like a one size fits all. However, within a regional approach, we can take more of an account of the differences or the variability across and within that region. We know from our regional work that there could be more similarities between countries across regions, and it's about understanding the characteristics of the nations within a region that will enable us to even do that. FIP has a very clear adopt and adapt approach, so that what we might produce on a global level is adaptable for countries, and that then we can use them as shining lights for others to learn from as well. So it's almost like a learning cycle for nations, a little bit like a CPD or a continuing education cycle that we ourselves would have. And I think if we adopt that in our mindset, then it really means that nothing is ever perfectly adaptable for a country. But additionally, if a country can adapt and shape it to their needs and their systems and their regulatory authorities and, then we have models where this can be adapted by others as well. So it's all a learning and sharing process. I think the big thing for FIP is our uniting vision, which is to advance pharmacy worldwide. And that we know that countries that have a lot of experience in a certain area, education is the focus of UNITWIN, could share that learning with countries that may find themselves a little bit further behind on the developments. But that the countries that have the experience understand that it's not copy-paste, it's not a lift and shift, it's not an immediate imposition of a model that works in one country on another. We've got great examples of this. Most of our work at FIP seeks to find out what we globally might pull together as principles, and then we always illustrate that with country case studies. And I think some of the biggest benefits that FIP has had to advance pharmacy worldwide is around the issue, the real issue of ensuring we have the right academic capacity, the right skills for our educators in a country. We also look at the needs of that country, we look at their systems, and we see where pharmacy can fit, can contribute, can amplify, and can really make a difference to the patients and the public in that country. And what we also really do, and we love to do, is to feed back all the learning from a country that may be going through such a transformation to the countries that may have viewed themselves as more experienced. In this regard, and I have a lot of problems with the term developing countries, I actually think this means everyone, every country is developing and learning from each other. So this is where we can unite and unify our experiences. And we have the word UNITWIN. I actually think it is a uniting network. It is a unifying network, and it is something that we can all learn from, as well as between our higher education institutions. So they're my principles for you, Dalia, that we seek to share the knowledge from those that have experience with the knowledge that need experience, but we provide a feedback loop that means we are constantly developing, and together we'll advance pharmacy education worldwide. I'm really excited by this launch today, And I cannot wait to see the advancements that we will see in this region, but also for the rest of the world to learn from as well. Thank you, Dalia.
Thank you so much, Catherine. And you really summed up the key pillars of the UNITWIN network work, because it's really about partnerships, education, delivery, shared experiences. You're talking about the loop mechanism, Catherine, learning from one country and moving on to the next, sharing best practices, and underpinning all of that work by partnerships. And I feel, Catherine, that we could remind our audience of our 21 development goals. And actually, we have one development goal, specific development goal number 8, that is about working with others. So how important is that to drive our agenda to advance pharmacy worldwide? Thank you so much for your remarks. I would like to move us on to Professor Altieri. Ralph, you have been heavily involved in the development, in the advancement of the UNITWIN program over the years. And I must share that I did come across a press release from FIP exactly 3 years ago, where I quote you, where you've said that the FIP-UNESCO UNITWIN Centre for Excellence in Africa has been an incubator for education reform. You also said that we invite students, faculty members, national pharmacy organizations, and governments to use this report as a roadmap to advance pharmacy education and the pharmaceutical workforce across Africa and throughout the world. In the next decade, FIP will focus on the renewal and expansion of the FIP-UNESCO UNITWIN program across other regions of the world. So, Ralph, here we are today, launching the Southeast Asia Centre for Excellence. So I would love for you to share with our audience what the value is of networking, this word that has been resonating throughout this presentation, the value of networking and sharing of successes and even lessons learned or failures, so we can all learn and progress together. The floor is yours. May I please ask you to unmute yourself, Ralph? Thank you.
It's always key to these Zoom meetings, right? Unmute. So thank you for those words of introduction and reminding me what I stated several years ago, which continues to be true today. So let me first add my welcome to everyone, and thank you for joining us today, especially those founding members of the Southeast Asia region Center for Excellence in Pharmacy Education. So following on Dalia's just remarks of introduction, today really is a great day for UNITWIN program, because now we're beginning to globalize that program region by region, moving out of Africa now to Southeast Asia, and then we'll move on to the others. So let me begin by stating the obvious. Academic programs and their curricula are always a work in progress. It sort of goes along with what Catherine just said. We are all developing countries when it comes to our curricula in our schools, because it's a never-changing process. As times change, as new knowledge is generated, as societal needs develop, academia must adapt and change. And in many cases, academia, through its research efforts and clinical care efforts, can lead that change in the world of science and practice. So as you've heard, the FIP-UNESCO UNITWIN program really is designed to be a catalyst and a convener to foster pharmacy and pharmaceutical sciences education, change, and transformation to meet the needs of the citizens in our countries, our regions, and the world. From my point of view, this is a moral and an ethical obligation that we all have as academics. And now all of you are part of that commitment and endeavor. So as mentioned already, and I will continue down this road, is key to transforming pharmacy education is the need to network, partner, share among our colleagues from within pharmacy education and educational experts that lie outside of the world of pharmacy. My remarks will focus mostly on the opportunities that are internal to FIP and to pharmacy education. What support and resources you might have from FIP to assist you and the Center for Excellence to succeed. You've heard some already. The easy answer is fip.org. You get on the home page in the upper right, it says library, click on there and you're going to find all of these. And I think Dahlia is going to come back to that a little bit later in the presentation to show you what some of those are and how to access them. At any rate, I'm going to mention 3 areas for consideration here of this idea of networking and collaborating and partnering. Is the Pharmacy Education in Sub-Saharan Africa report, where UNITWIN began. You already heard some of that. The FIP-WHO partnership in substandard and falsified medicines, and the FIP Pharma Bridge program. So I'll begin with the Sub-Saharan Africa report and what came out of that UNESCO UNITWIN program in Sub-Saharan Africa and the Center for Excellence in Africa. And so I'll go through a few reflections of members of that original Center for Excellence. Now, there were 3 areas that the group decided upon that they were going to focus on: academic capacity, needs-based education, and advocacy. So some of these you saw in Allison's slides, but I'm going to go through them again a little bit more detail. So Dr. Tim Rennie was the dean at the time of the University in Namibia, abbreviated UNAM, and at the time it was a new pharmacy school. And here are his reflections on the Center for Excellence. The Center for Excellence provided a platform for networking between institutions across different regions in Africa to engage with common challenges, to seek support from established institutions that were more in touch with the problems to overcome as a developing new school. The center connected UNAM with the broader networks and resources in FIP and associated institutions. A great example of this was the first use in Africa of My Dispense, which was developed by Monash University. A number of center members have provided service to UNAM, for example, as external examiners and consultants, to strengthen the quality of output of the educational programs in a part of the world where there are the fewest number of healthcare practitioners. They also provided training, information on training resources and expertise around Africa and beyond to support the developing program at the University of Namibia. Dr. Ifadola Olojo from Lagos, Nigeria, wrote that as a project lead of a subunit, academic capacity of the Center for Excellence, I, together with my team, carried out various educational standard assessments across the center member countries, determined limitations and strengths of pharmacy institutions. Working with the UNESCO program team in line with the FIP education strategic objectives, we were able to develop university staff exchange programs, mentorship programs to assist getting pharmacy staff in attending international education programs such as the FIP Pharma Bridge program, which I'll mention in a few minutes. I was exposed to proper training techniques of assessment and mapping of each country's pharmacy curriculum, as well as providing support to member countries in the areas of academic capacity. You can see the theme that's going here, these partnerships and sharing knowledge and sharing, successes and things maybe that weren't quite as successful is so helpful to everybody who's part of the center. From Nairobi, the opportunities within the center for staff and student exchange were critical in capacity building and technology transfer in pharmacy practice. And we were very helpful to move, this will be very helpful to move to make our curriculum more clinically based. We've heard this already for the Southeast Asia region, so as to have graduates fitting better into practice. The Kenya government is rolling out universal health coverage whereby pharmacists are expected to offer primary health care in fields such as vaccination, contraception, and public health. This highlights the requirement for needs-based education. And this is really important as we proceed with all of our centers for excellence. This has to be a founding principle. I think you've heard already about the advocacy efforts from Uganda, where the advocacy, and again, this was one of the three major areas for this Center for Excellence in Africa. It expanded the possibility for the department to attract a large pool of external examiners and led to the enhancement of quality control in their education system. In addition, through advocacy, the Ministry of Health recognized the wide-ranging possibilities of pharmacy participating in the country's health system, which had hitherto not taken root in Uganda. So you can see that these partnerships within UNITWIN are having really large effects within each country, within the universities, within the curricula, but also with the ministries of health and changing policy on a national level. You have a lot of opportunity, and I would say a lot of power within your partnerships to really change the landscape for pharmacy and pharmacy practice. The second area I want to explore just a little bit is the FIP-WHO partnership on substandard and falsified meds. Using the structural organization of the Center for Excellence in Africa, FIP embarked on a program with WHO to develop a pharmacy curriculum on substandard and falsified medicines for practitioners and students. There were several deliverables that were completed recently, a competency framework based on knowledge, skills, and attitudes related to substandard and falsified meds to be used in the undergraduate pharmacy programs. The development of a comprehensive course and curriculum in substandard and falsified meds for undergraduate programs, available in both French and English. This resulted in a publication in 2021, Curriculum for Pharmacy Students on Substandard and Falsified Medicines, and this is available to everyone to use if they would like, and this is in the FIP library. And that has been successfully deployed in several countries in Africa and was recently published in the British Medical Journal Global Health. The third and last component that I'll talk about that FIP has for supporting networking and sharing of expertise and need is the FIP PharmaBridge program. This sits within the FIP Foundation. Easiest way to access it is just Google FIP PharmaBridge, and you'll go directly to the website for this. What is this program about? Host institutions will join PharmaBridge. They'll provide information on their areas of expertise, similar to what Rajani was showing us for each of the members here in this Center for Excellence. Guest institutions will join PharmaBridge in areas where they seek advice, guidance, or mentorship in program development. PharmaBridge matches hosts with guests and assists in arranging visits between host institutions and guest institutions. And these have been traditionally in person, but now they're also being done virtually, as you might imagine. My school has had experience in the PharmaBridge program prior to the pandemic in person. And what I can tell you is the value is tremendous because we both learn from each other. We as the host institution can teach and provide information to our guests, but we also learn from our guests and what they are doing in their region that really might be important for us as well. So it's been it's a terrific program. If you have the opportunity, I say get on that website and look at it. It's a great way to really partner with others who have the strengths that you may need to develop in your program. So the bottom line is, and I may have overused my time already, but we're almost at the end, is the UNITWIN program and the new Centers for Excellence in all 6 WHO regions provide the platform that supports both regional and global networks of pharmacy schools to promote and support networking, collaborations, partnerships to advance and transform pharmacy education now and in the future, using the many resources that exist in FIP education, practice, and science. So really, you're going to be working within your region. And as we develop these centers for excellence around the world, we'll be forming global networks as well, which is an exciting proposition coming up, I hope, by the end of 2024. So thanks for your attention. And if we have time later for questions, happy to answer them. Oh,
Thank
I
you
might
so
mention
much.
one other thing. I'll mention one other one, Dahlia, because you the head this up for FIP, and it's been mentioned before as the SEAL and Provision Program. If there's time, you might want to let people know about that as well. Yeah.
Fantastic, Ralph. I think that you shared some really inspiring examples. And I think here we have founding members that are truly probably inspired by all of this to be able to have some lessons learned, shared experiences. I'm sure Rajani, Andy, and Editha will join me in that. Fantastic examples, Ralph. Thank you so much. And FIP is the enabler for all of these platforms. So we're delighted by this. I'm going to go straight to Andy and Editha, and maybe comments from Rajani as well on, after listening to Ralph and Catherine's comments, how do you aspire as founding members to contribute to the development of the Centre for Excellence? I'll start with Andy and then we'll go straight to Editha.
Right. Thank you very much, Dahlia, for this opportunity. And also I would like to acknowledge and appreciate everyone for attending this launch of the FIP-UNESCO UNITWIN project. So we at the Faculty of Pharmacy, Universitas Airlangga Indonesia, have a vision to make a difference in the global healthcare, and particularly the delivery of good pharmacy practice by promoting a global and collaborative approach to educational challenges. Now, we are aware that Southeast Asia, as mentioned by Shirley, a home to approximately 2 billion of world population, is a region of enormous social, economic, and political diversity, both across and within countries. And it's shaped by its history, geography, and also positions of a major crossroad of trade and movement of goods and services. Now, these factors actually have not only contributed to the disparate health status of the region's diverse populations, but also to the diverse nature of its health system, which are at varying stages of evolution. Now, what we have known so far in pharmacy landscape in the region is also changing, which creates both opportunities and challenges in pharmacy workforce. For instance, Shirley also has mentioned that the pharmacist numbers have doubled within the past decade, and this includes Indonesia, which experienced exponential increase of pharmacist graduates. In addition, the demand for role expansion, the pharmacist role expansion, has an impact of societal changes and growing economics of scale of countries within the regions, has become a signal for us to improve the quality of pharmacy workforce through education. Now, we at the Faculty of Pharmacy, Universitas Airlangga, therefore, urges that harmonization, advancement, and partnerships among the schools of pharmacy is indeed required. We believe that building university networks and encouraging inter-university cooperation may advance research, training, and curriculum development in pharmacy education. And therefore, we would like to invite all schools of pharmacy within the region to collaboratively and actively work within this Center for Excellence. I think that's the key for these questions, Dahlia.
That's perfect, Andy. Thank you. Editha, what are your remarks?
All right, thank you so much, Dahlia. Well, before I go to your question, I want to give a little bit background about our institution, because Faculty of Military Pharmacy is a new faculty. So we were firstly established in 2020, and this is our 4th year for our undergraduate program. So referring to our vision that we want to be a leader, especially in the military pharmacy in 2024 at the global level, which preserve also the national values. So for that reason, we try to make some vision, especially when focusing on teaching or education, research, community service, as well as we try to have collaboration as much as possible, because we are quite a new faculty. And also our institution has become the member of FIP since the beginning of our establishment. And we found that this helped us a lot to grow. This collaboration really give lots of interesting program, especially in teaching and education, since we've already have several joint programs together. And I know that in the FIP, we have military and emergency pharmacy sections in which we are also closely have a good collaboration with this pharmacy section. So becoming the member of this Center of Excellence is very great opportunity because as you know that our faculty is brand new, a new one, and it is very vital for our faculty to have more collaboration, more opportunity, especially we would like to expand our networking partnership within the Southeast Asia region. And the objective of this program, the Center of Excellence, really match our needs, especially in networking, in partnership. This is the two key important point that we still want to consistently improve and be expand about this. Moreover, educational development is also another important thing because we call our student cadets. We want our cadets to have a global mindset. And since our faculty is in a military pharmacy, I believe that some of you are not familiar with that. And the next objective of this program in sharing experience will be another key point for us to be part of this program so that people will be more familiar with military pharmacy, and in practical, we could have best practice collaborations as a pharmacist, especially in military pharmacy. I hope that answers your question. Thank you.
That's very enriching, Edith, and it's lovely to know that also you're a new member of FIP as AIM, but also as a new School of Pharmacy in your country. And I think what's resonating here with all of our speakers, the common thread is that actually no one wants to work alone anymore. I think it's not about no longer silos of practice, education and clinical, but it's also science. It's also about we don't want to work alone within our own set of practice or settings. So I'm grateful for those comments. Rajani, what are your thoughts as the lead, but also as a founding member of the Center for Excellence, and what do you hope to bring to it?
Thank you, Dalia, for the question. By institution and myself, we are very excited to work for this. Kathmandu University, we started BPharm program in 1994. We are the first one to start this program in Nepal. Besides BPharm, we are running MPharm in several specializations. We do offer PharmD post-baccalaureate program, and we also do have PhD in pharmacy. Right from the inception, we tried to maintain a very dynamic curriculum. Ralph has rightly said just now that academia is always work in progress. We also believe that curriculum should always be up to date and remodeled according to improvements in knowledge and advancements in the area. Coming to your question, I would also like to commence with curricular improvement and harmonization. Education, we know, has a very important role to produce workforce. Pharmacy institutions are no doubt striving very hard to produce graduates with all the essential knowledge, skills, competencies, etc. But we can't deny that there are always a gap between education and actual practice of pharmacists. In our region, pharmacy education and research might be lagging behind somewhere. So it is very important for the academic institutions to look after this thing. It is important for the colleges and institutions to have comprehensive curriculum on pharmaceutical sciences, pharmacy practice-related courses. But while offering such curriculum, sometimes we make students overloaded with heavy subjects. And ironically, sometimes we can also see that graduates are applying less in their work, what we have taught them. So it's a great challenge in pharmacy colleges to equip pharmaceutical workforce with the right balance of the right competencies that meet healthcare need of the countries and its people. And given the current pharmacy education scenario in some of the countries of this region, as we have been repeatedly saying, there is a requirement to focus on needs-based educational model that emphasizes on development of competencies for for provision of pharmacy, patient care, and other professional services in the local setting. And we believe that we can contribute very well in this process of improving academic capacity in this region to prepare pharmacy workforce for a wide variety of currently existing and also potential future roles. Countries in Southeast Asia region share more or less similar strengths and challenges in profession. And I believe that if educational institutions of this region can collaborate, we can together strengthen academic capacity and also our profession. And it is an excellent opportunity conferred upon us. Through this Center of Excellence, we will be strengthening our partnership with other academic institutions of this region to strengthen academic capacity and also promote harmonization of pharmacy education. To what extent harmonization should be made and what can be the strategies for this, we still need to work upon. And next, we can work is adapting FIP Global Competency Framework, drafting a country-specific frameworks according to the local needs. This is where we can work together with our member institutions. And also, there is a need to foster collaboration between institutions to enhance and expand research opportunities. Implementation of pharmaceutical care services has been variable across our region. In some countries, we can see clinical pharmacy practice has undergone promising changes, where in some countries, including Nepal, it is still in the primitive stage that need to be reinforced, that need to be expanded. But I can say that our region has good strength in the area of pharmaceutical sciences. We are doing very well in the area of drug delivery system, research activities related to medicinal plant, natural products. And these are the areas where we can contribute substantially in terms of academic activities and research. And another thing I need to mention is that we have also less awareness on CPD, which must be encouraged to increase pharmacists' professional competencies. And we are very delighted to work with the Center of Excellence to develop CPD toolkit for this reason.
Fantastic. That was one of the main priorities for the center, I believe. Thank you, Rajani. Wishing you all the best with this great initiative and all the upcoming endeavors. We unfortunately missed Dr. Rao, who's the professional secretary for the Southeast Asian Regional Forum. But on the call with us, Shirley, I believe you have some comments from Dr. Rao that you're happy to share with us. Sorry, we've missed him.
Thank you so much, Delia. Yes, we actually have some comments from Dr. Rao about several challenges that may be a barrier for effective collaboration. And I can see actually from the comments that he provided to us is actually it can be tackled by the UNITWIN, the Center of Excellence that we launched today actually. So a couple of things that he mentioned is about like the diversity across region, the language and cultural barriers, differences in pharmaceutical education between different countries, differences between nations as well, and also like countries in Southeast Asia region have like different allegiance towards the professional organizations, not only with FIP but also with the other organizations within the Southeast Asia region itself. Like for example, from the Federation of Asian Pharmaceutical Associations, Commonwealth Pharmacists Association, and Asian Association of School of Pharmacy, and all of the barriers actually bring his points to the essentiality of to get all of the member organization or institution to have like a common platform to achieve the objectives, which is the launch of today's basically the UNITWIN one, which is it will strengthen the collaboration, it will encourage the shared learning between each other. So all of the things that actually what he provided to us about the challenges can be tackled with this. And one last thing that I would like to highlight from his point is about like he mentions another challenges related to Southeast Asia Regional Pharmaceutical Forum itself, which is the forum has not been successful so far in setting up like a common interactive platform with member organizations across Southeast Asia region. And I think not only UNITWIN, but also the integration of the regional forum with FIP could be something that also help tackling these challenges. So yeah, I think that's what I would like to share on behalf of Dr. Rao today. Thank you, Dahlia. Over back to you.
Thank you, Shirley, and thank you, Dr. Rao, for those comments. And we missed you today, but very valid and sums up really what actually Andy and Editha kind of started off with about the challenges of the region and the importance of coming together for this centre. Shirley, you concluded your Dr. Rao's remarks by how much they value the current plans, the imminent plans for the integration of the regional forums with FIP. And I'm not sure, Catherine, if in 30 seconds or a minute, you can provide our spectators with a bit of an overview about this and where we're going next with it and how important it is, maybe.
Yeah, thank you, Dahlia. I think the UNITWIN network is an example of how FIP needs to have a regional approach to collating examples of good practice, sharing and showcasing. And we are in the process at the moment of integrating our regional forums back into FIP. They have the footprint of the WHO regions. So within each region, there's a lot of variability based on the countries that the footprint covers, but a lot of opportunity here. So we would regard the UNITWIN network as a fundamental network within the regional forum. It will become a network in each of the regional forums, but you can see we're taking a step-by-step approach so that we're learning as we go and that we are passing the baton on, but sharing the learning as well. So I'm really, really excited that we will have this as an opportunity for our Southeast Asia regional forum through this UNITWIN network. And it's a really important development. I would say, coming on to Rajani's point about CPD and continuing education, we have a lot to share from FIP, but also, as I mentioned, a lot for you to adopt and adapt based on your needs regionally, but also using the country case approach as well. And I think having FIP learning and continually developing and advancing is a really nice approach for us, Dahlia, to take as a philosophy. Again, my thanks, but I think this really all fits beautifully together. The jigsaws are starting to really fit together, understanding that the shapes and the pieces may be slightly different. Thank you.
Thank you so much, Catherine. And we're coming to the end of this particular segment, colleagues, and we are delighted to have had you with us. But I am wondering if there's any final remarks from any of the panelists in 30 seconds or so before I wrap up the session. Anything from Andy or Editha or Rajani or Ralph?
Yes.
If there are no further remarks. Yeah, Andy, please.
Yeah, so we will stand strong with together with the FIP, the UNESCO, and work together with the founding partners within the center to create these centers for excellence and to help tackle the educational systems and workforce and also challenges within the region. So this is our commitment for the Center of Excellence.
And we are going to be working with you, Andy, as Catherine says, shoulder to shoulder. Thank you so much. Thank you so much, colleagues. Shirley, I have a couple of slides to walk our colleagues through just with some resources, and I won't spend too much time on this, but I think what I really need to announce to our colleagues and audience is the fact that this is part of a big rollout plan of the regional centers for excellence across all WHO regions. So today is the second one, and we have plans to launch the remaining centers for excellence in 2024, truly leaving no region behind. And for those of you that would like to know more about this, the initiatives, if more of you want to know how to get involved, how to get engaged, if you're an academic pharmacy section member, if you are a representative from an academic pharmacy, academic institutional member, if you belong to an FIP member organization as a representative, please do write to us. We would love to hear from you, to engage with you, and to inform you of how you can be involved in the development and the advancement of the regional centers for excellence, as appears on your screen. Lastly, I would like to bring your attention to explore the FIP Education Toolkit. Really, it's a hub of resources. We provide you with a QR code here for your convenience. Do explore it, do go on there and have a look at all the various reports and resources and case studies that have come through from all of our member organizations, particularly from Africa, relating to the UNITWIN program. Thanks, Shirley. On the following 3 slides, here, year by year since 2020, we provide you with an array of resources, from frameworks to statements to online digital health report and online courses. You can proceed, Shirley, because our colleagues can see those slides when they replay the recording, to other resources related to FIP, pharmaceutical education transformation, all appearing here on your slides, but all can be accessed through our fantastic library that Ralph initially was talking to you about. With that, colleagues, I want to thank you for being with us today. And for those of you that are already thinking about joining us for our next FIP Congress, which will be hosted by Cape Town, here is a slide to remind you that we invite you from now to start thinking about joining us, you and your organizations, for our 82nd FIP World Congress of Pharmacy and Pharmaceutical Sciences, titled Innovating for the Future of Healthcare. Today's episode, today's event, with the launch of the new UNITWIN Centre for Excellence, is all about innovation. We are being innovative in the ways that we're working to advance pharmacy in a variety of ways, and we are proud and delighted to take you with us on that journey. I can't wait to start working with the founding members and all of our colleagues to action some of this work. Thank you so much for joining us, colleagues, speakers, panelists, for your time, experiences and expertise, and I wish you a pleasant day or night ahead. Thank you so much. Take care, everyone.